Hi, this is Dr. Matt Bader from Cognitive Psychiatry of Chapel Hill, and I just wanted to take a couple minutes with you today to talk about a new medication that's recently been approved for the treatment of opiate dependence, or pain pill addiction as you may have heard it called. The medication name is Bunavail, and I have a little handout or pamphlet right here, so I'll hold that up so you can see the name, and I'll try to point to, boom, one of the unique features of the medication. We'll talk about that in a moment. It's more difficult to point on camera than you would think. Anyway, so the two main medications on the market today for treatment of opiate dependence are Suboxone and Zubsolv. So, like Suboxone and Zubsolv, Bunavail has two medications or two active ingredients within it. The first one is buprenorphine, which is the partial opiate agonist, and the second one is naloxone, which is an anti-opiate or opiate blocker. So how is Bunavail different from Suboxone and Zubsolv? Well, the first relates to how the medication is delivered, which I tried to point to a moment ago. So Suboxone and Zubsolv are dissolved under the tongue, whereas Bunavail is actually a film that goes on the inside of your cheek called the buccal mucosa, which is just a fancy word for inside of your cheek. That's where it sits, that's where it dissolves. So the makers of Bunavail say this is an advantage over Suboxone and Zubsolv, as they say with Bunavail in your cheek you can kind of talk and swallow as you normally would, whereas perhaps those using Suboxone and Zubsolv would have difficulties as the tablet or film dissolved. Of course, when Bunavail is inside of your cheek, you shouldn't be eating or drinking. You also shouldn't chew or swallow the medication, as all those things would make it less effective. So, kind of where the medication goes, how you take it, that's one difference. Second difference of Bunavail versus Suboxone and Zubsolv is its bioavailability, which is basically just a fancy word to describe how efficient a medication is in terms of getting into your system. So when you take a medication, not all of it is actually active inside of your body. So for example, 8 milligrams of buprenorphine in Suboxone is equal to 5.7 milligrams in Zubsolv, which is equal to 4.2 milligrams in Bunavail. Why don't they just make nice round and even numbers? I'm not sure, but that's not for us to decide. But what all that is to say is that Bunavail is more efficient in terms of getting medication into your system. So if you're on Bunavail, you're prescribed a lower total dose of buprenorphine and naloxone. So that's one other difference. And a third kind of maybe less important difference versus bioavailability and how you actually take the medication is taste. Not to downplay taste, it's obviously can be important for a lot of people. But so Suboxone is described as having a bitter orange taste. Zubsolv has a menthol taste, and the makers of Bunavail say it has a pleasant citrus taste. So maybe that's something to consider. At this point in time, we don't know how Bunavail compares to Suboxone and Zubsolv in terms of head-to-head studies. Hopefully those are done at some point. Bunavail makers did do a study where basically people that were maintained on Suboxone and taking that for opiate dependence were then switched to Bunavail over 12 weeks. And basically people said it was tolerable, they were able to switch without problems, and most people stayed in the study over 12 weeks. So we'll see what the future holds in terms of head-to-head studies and how Bunavail stacks up to Suboxone and Zubsolv. But right now it's another medication on the market to hopefully help treat this rising epidemic of opiate dependence and all those that are struggling with it. If you have any further questions, you should clearly discuss those with your doctor, your physician. If you'd like to ask me any questions or reach out, just do so via the contact information below. Thanks for your time. Have a good day.